So good morning everyone. I'm a third year physiotherapy student and today we are going to discuss about ischemic heart disease, the most important topic in cardiology in the perspective of medicine 1. Okay. First we'll start with the definition. Ischemic heart disease is a condition in which there is a reduced blood supply. There's a reduced blood supply to the heart muscles. Okay. Okay. This is the first sentence. Second sentence is due to narrowing or blockage of coronary artery. Why the blood supply in the heart muscles reduces? It reduces just a second. It reduces due to the narrowing or blockage of coronary arteries, most commonly from atherosclerosis. Okay. Types of ischemic heart diseases: stable angina, chest pain due to temporary reduction in blood supply to the heart. See, just remember these key points, okay? Chest pain occurs, okay? Chest pain is the most common symptom of ischemic heart disease. So, chest pain occurs due to temporary reduction in blood supply to the heart, okay? This is in stable angina, which is caused by narrowing of coronary arteries, as we have discussed in the definition. This is the definition of ischemic heart disease. Aggravating factors: main pain occurs on exertion, stress, or climbing stairs. Okay. Relieving factors: pain relieved by rest or nitrates. Okay. What is the nature of pain? The nature of pain is tightness or pressure in the chest. Pain radiates. Okay. Pain radiates from left arm or jaw. Pain radiates from left arm or jaw. Okay. Second type is the unstable angina. This is the most severe form of angina. Occurs due to plaque rupture. I'm sorry. Occurs due to plaque rupture or partial thrombosis. Okay. Occurs due to plaque rupture or partial thrombosis. What are the aggravating factors? Aggravating factors are the at rest, and second is the increased frequency of severity. An unstable angina has a high risk of progressing to myocardial infarction. Okay. See, as you can appreciate in this diagram, coronary artery with atherosclerotic plaque. Okay. This is the heart. This is the coronary artery supplying the blood to the heart muscles, and there is a fatty deposit, okay, inside the walls of the coronary artery. So see here, it's written atherosclerotic plaque is a fatty deposit that forms inside the wall of an artery. I hope you got that. You can even draw this diagram in the exam for better understanding. Myocardial infarction. This is the third type. Permanent death of heart muscles occurs due to complete occlusion of coronary artery by thrombus formation. Okay. What are the symptoms? Symptoms are severe chest pain that is more than 20 minutes, not relieved by rest, sweating, nausea, vomiting, breathlessness. They are symptoms of myocardial infarction. Okay. ECG changes. So you can appreciate ST elevation, T wave inversion, and Q waves in ECG. Okay. We'll do the separate video on ECG very soon. Okay. Complications: arrhythmias, heart failure, and cardiogenic shock. These are the complications of myocardial infarction. So, silent ischemia. By the name, you can understand ischemia without chest pain. The patient has no typical symptoms. So, this is the reason it's called silent ischemia. Seen in diabetic patients or elderly patients. Okay. Investigation: ECG changes, stress test, or Holter monitoring. Okay. What is Holter monitoring? Holter monitoring is continuous ECG recording for 24 to 48 hours while the patient carries on with the normal daily living activities. Okay. Danger can lead to MI or sudden death without warning. Okay. Because it's silent ischemia, so the symptoms are not known. There's no chest pain to the patients, so it can lead, it can be fatal or even lead to MI. Okay. Sudden cardiac death, unexpected death due to cardiac causes, occurs with 1 hour of symptom onset. What are the causes? Ventricular fibrillation. What is ventricular fibrillation? Is a fatal erythema in which the ventricles fibrillate instead of contracting, leading to sudden cardiac arrest. Okay. Second cause is the severe ischemia. Okay. Often seen in known case of ischemic heart disease patients. So this is the flow chart. You can draw this flow chart in the exam. Stable angina. What we have discussed in the stable angina. In this, there is a temporary reduction in blood supply to the heart. Okay. Just remember temporary reduction. Unstable angina. This is the most severe form of angina and occurs due to plaque rupture. Okay, this occurs due to plaque rupture and partial thrombosis. Okay, next we'll come to the myocardial infarction, MI. Okay, in this permanent death of heart muscles, and this is a permanent death of heart muscles and silent ischemia. So there are no symptoms and there's no chest pain to the patient, and this can be fatal or can even lead to MI. And fifth and the last one is a sudden cardiac death. In this, there is an unexpected death of the patient due to cardiac causes. So, what are the risk factors? Risk factors are smoking, diabetes mellitus, hypertension, obesity, or any family history or genetic. Okay, we'll come to the clinical features. Retrosternal chest pain. What is retrosternal chest pain? So, see, I've divided this word into two. Retro means behind, and sternal is a breastbone, you know that. So, retrosternal chest pain means pain felt behind the breastbone. And what is the type of pain? Crushing pain or tightness. Okay. Second is the sweating or nausea and breathlessness. So, see, this is the heart, and what are the most common epicardial coronary arteries involved in ischemic heart diseases? So they are right coronary artery, left anterior descending artery, and left circumflex artery. Okay. See, you can appreciate that in the diagram. You can even draw this diagram in the exam. Investigation. What are the investigation? ECG. As I have told you, we'll do the separate topic on that. Separate video on that. Second is the echocardiography, and third is the coronary angiography. What are the management? What are the management for ischemic heart diseases? So first is the lifestyle modification, smoking cessation, diet, exercises. Second is the medical management, in that you can give aspirin, nitrates, beta blockers, or ACE inhibitors. Third is the interventional management, in that angioplasty plus stent. Okay. What are the complications of ischemic heart disease? So complications are MI, okay, heart failure, erythemas, or sudden cardiac death. These are the complications of ischemic heart disease. I hope you understood all the topics in a better way. If you need the PDF of the video, you can DM me on Insta. Okay, thank you so much.